The Northwest Provincial Command Council, led by Premier Job Mokhoro, who will be accompanied by the Health Minister, Dr. Zweli Mkhize, will once again gather at the George Shimangani Hospital in Rustenburg, where personal protective equipment will be donated to the government by the Sibanye-Stillwater Platinum Mine and Old Mutual. We brought you that address earlier on. Let's go back there live.
Many months, or many weeks, sounds like many years now. But thank you for the work that you have done informing our country, our nation, about this very complex outbreak that we are dealing with. The importance of the messaging coming from the media is that you are this main and the only source of information to our people, and information and knowledge are the main weapons we need for our people to be able to lead the fight against the coronavirus as an outbreak. It is with proper information, scientific-based interventions that will be able to deal with the COVID-19 outbreak. And in this case, we want to pay tribute to the media for all the work that we have done. And I'm saying this particularly because at the beginning we did have a problem of a lot of fake news. And we thought that at the point, some of the members of the media did get a bit taken into the sensational angles that some of these brought about. But I think we have all matured up now to a point that we no longer worry about fake news. We simply correct it once, and then, of course, people know they can't fabricate and they can't propagate fake news, because it's actually the first enemy we have in dealing a blow to the COVID-19 epidemic or pandemic. And so I want to commend you for that, your consistency at all hours of the day and night, seeking information and making sure that our nation is well informed. I think the experience all over the world has shown that it is well-informed communities that tend to fare better in the fight against this pandemic. And in this case, media becomes one of the major partners in the fight against the pandemic. And it is because of that that our people can actually be out there and starting to share information about distancing, about hand sanitizers, about use of water and soap, about use of masks. And when you go out there, for the time that we have had to face the reality of COVID-19, I think the uptake of our people has been fairly strong. Yes, you will find a number of areas where people behave in a manner that we find unacceptable, but I think, if truth be told, the majority of people are actually listening to the correct message. And the majority of the people are trying to do their best. There are instances where circumstances beyond their control make people not to be seemingly responsive. So, for example, the pressure of having to go out and look for essentials such as food, and the loss of income is actually what is putting pressure on a lot of our people. And so we think that it's important for the message to be sent to our people to say, with all the challenges that they are going through, we do understand, we do appreciate, but we must say that whatever we see as our progress in fighting COVID-19 is actually more their victory. It's not so much the victory of government or the health workers and professionals. It is more about how people themselves have internalized the messages on the containment measures that will help to save our country. And so from that point of view, I think the major message for us is about partnership. Everyone has to be a part of this network of partners that must look always at what they can do to contribute to the fight against COVID-19. And therefore, we want to, at this point, pay tribute to the partners in the private sector who have contributed in various forms. And today, the representation of those partners are the two companies that we are here to acknowledge. Firstly, the company, the Sibanye Still Water, has made a huge contribution. They have offered some food relief packages, working with the provincial government, and we want to thank you for that, and we believe it's the right way to go about it. Come and work with government to see how we can actually help our people who are in distress. So acknowledge that, but secondly, for today, we also note that there has been offers for facilities to be made available to help us to get additional space for admitting patients. Those hospital beds that we have offered, we appreciate them because at this point we are going to have to look at increasing the amount of space wherein we're going to be admitting people as part of what we call field hospital beds. Now, the value of the field hospital beds works in particularly in the way that we need to get to a point where we are able to separate people who have got other morbidities, other illnesses, other challenges, who have to come to hospital, who have been coming all along before we had this COVID-19 pandemic. They need to be separated from those who have got a potential to infect them, because we have realized that most of our mortality is associated with people with comorbidities. One of the lessons from China has been the fact that if we don't protect people with comorbidities, it tends to push the mortality rate very high. And in this case, we have now gone out to say all our hospitals must start putting up what we call triage facilities, where on the front gate we should be able to separate people who might be having respiratory symptoms, move them to another area where they could be seen, where they could be isolated, where they could be tested, so that should there be a possibility of them being infected and infectious, then they should not be contaminating the environment where people with other illnesses but no COVID-19 infection could be found, and therefore you end up with a cross-infection that tends to decimate those who have got comorbidities. It's a very important development because in a number of instances we've also got over 80% of the people have got mild or no symptoms, which means that people will be infective, but they still won't know about it. But what it means is that if we found that someone was positive, we can admit them, not so much that they need to be treated in hospital, but more because we need them to be away from where, when they are infectious or when they're infective to other people, they could cause more damage. In other words, there are patients now who need not be in the hospital, but we keep them in a hospital simply because all we're saying is that until the viral shedding process stops, the person might cause a risk to their own families and close relatives. So what it then means is that we'll move people and put them into the field hospital beds, and therefore keep them there even if they don't need any treatment, just so that the period where the wave of the infection is highest and therefore the risk of infecting others is still high, they should be in a facility even if they don't need any medication, any treatment. That we will do particularly for people whose family environment is such that their homes may not be able to help them to self-isolate. There may be overcrowding, there may be too many people in the neighborhood who could inadvertently, unknowingly pass into the house and end up contracting the infection. So the numbers that we are going to be seeing that are going to be recorded as being in hospital are not necessarily an indication of the severity of the infection on the individual, but they are more an indication of the spread of the infection into areas which may not be able to self-isolate at home. The first wave of the infection which we had was what we call imported cases. These tended to be people who had means to be able to self-isolate in their own homes. They could lock the gate and no one will come inside the gate until the period at which those the infection is considered to have actually dissipated in the body. So we will therefore be seeing numbers increasing being admitted mainly because of that. I am also very pleased to say most of the areas have actually gone all out to open up the field hospital beds. We have seen yesterday and last week President Cyril Ramaphosa, who has moved in the forefront on this pandemic, and he has been leading us from the front and giving us guidance and leadership, very bold steps and decisions that he has had to take together with the cabinet and ministers. In this case, yesterday we went to visit KwaZulu-Natal and we saw a number of the hospital beds, field beds. And I must say, when I said a few weeks back to my team, my colleagues, the MECs, that they must not look at the graph and start celebrating. They must know that we are actually seeing the calm before the storm, and a real devastating storm. I am very pleased to see that we have used the period to strengthen our infrastructure at the point, on the point of creating these field hospital beds. This contribution, therefore, from Sibanye-Stillwater comes in that vein to add in our facilities that we need to be able to admit more people, because there will be a need for more people to be admitted. We're seeing the numbers slowly increasing, and that increase indicates what we said at the beginning. At the beginning, we said every country will ultimately have COVID-19. We said that before we had our first patients, and we said there is no way that anybody can stop COVID-19 from getting into any country. And in this case, it has caught up with us. And secondly, we said many of us are going to get the infection. And that our role as the health services is not so much about trying to stop the infection from getting to each and every one of us, is slowing down the rate at which it gets to all of us. So when we say stand 1.5 meters apart, we're basically saying that it's going to take that long for the virus to get to the next person before, if there's a good distance between us. We said this is a droplet infection, that on a normal conversation, a cough and sneeze, it tends to spread up to about 1 meter away. And that means that if you stand beyond 1 meter, you are safer. Though that's not the only issue. We have said that because of the way we tend to use our hands, we would actually pick up infection that would have come from the droplets and use that to pass it to the next person when we shake hands and hug and kiss. And therefore we've said that on social occasions we need to reduce those kinds of activities, because you can never know when you've touched a surface that's already contaminated. Regular hand sanitizers and washing of hands becomes important as well, because every day, I mean, if you look at all of you, in the next 5 minutes you'd have touched your face many times. And your eyes, your mouth, your nose, you're everywhere. And this is normal. And so because of that, we now have to learn a new kind of behavior that's going to make it less probable that the infection can move to the next person because of that contamination. Now those issues are the basics, which are going to become, as the Chinese have said, new normal of how we relate. If you love someone so much, then don't touch them, don't hug them, don't kiss them. Stay afar from them. Because
well, we've coming out of this story, we've seen the different provincial command council. This is the Northwest Provincial Command Council led by Premier Job Mokgoro. They visited by Minister of Health, Dr. Zweli Mkhize, and the Minister of Energy, Gwede Mantashe, where they are giving a donation of PPEs. We'll continue to cover that as we're able to, but for now, let's take a break.